Hello everyone, my name is Imaze Marian Davis. Welcome to Marian Footcare Podcast. So today I have an interesting case. Case is actually quite common, among our family members, ourselves possibly, but we never want to talk about it. So today I'm going to talk to you about a 53-year-old female who's suffering from a condition called hammertoe deformities. People hear hammertoes, they're like, hammer? Like the toes were hammered? So hammertoe deformity is a curvature of our toes that we see that kind of develops over time. Usually when we're kids, if we have a little bit of hammering, it doesn't bother us because the toes are quite flexible when we're young. But as we get older, our bones can get very rigid because of that curvature. The hammertoe is when the toe curves like this. Now you have a little prominent on the top of the toes, and sometimes you can also get some darkness and discoloration in the area. And for diabetics, it gets worse than that. They can actually get ulceration. So this 53-year-old female had this rigid hammer toes. Her toes are like this. And I think on her pinky toe, she actually had like some calluses as well, which is, again, very common condition that a lot of people face. Mostly women, women are the ones that wear the wrong shoes and we're trying to look nice, look cute. And unfortunately, we pay the price for it in the future. And so with this condition, traditionally, people undergo open surgery for hammertoe correction. Open surgery meaning that they have to cut the skin open, reflect the joint, cut the joint out, sometimes put implants in there that keeps the toes straighter, or even K-wires, which are long pins and rods that they put in to help keep the toes all nice and straight. Traditional way of doing hammertoe correction is okay. There's no problem with that. It's just that, again, there comes the large scars. There's sometimes very, very rigid and abnormally looking toes. It's not a natural contour of the toes. And sometimes people have complications as well because a much larger incision means more chances of infection, right? Sometimes delayed healing if you don't have sufficient blood flow. So it's very important. Everybody knows out there, you must check the circulation to the toes prior to any foot surgery. So with this particular lady, she's been dealing with this for a long time. We're going to show you the picture of her presentation in the office, as you can see right above. And she was just tired of it. She wanted me to do something about it. And I told her, listen, we do in-office based surgery for hammertoe correction through minimum invasive surgery. So in this particular instance, after going through all the process, checking her blood flow, taking her x-ray, analyzing the x-ray, and seeing that we can reduce this deformity through just minimum invasive surgery. We were able to do the surgery right in office at my suite here at North Shore Medical Center in Miami, Florida, with just local anesthesia. Okay, we go through exactly the same surgical approach that we do in the operating room, where they completely sterilize the foot, and I use just small little incisions. On the picture above, you should be able to see the incisions that were made. And you can see that just through making small cuts on her bone, it's almost like I'm a bone bender or bone molder. I'm able to make the cut at the end of the joint, end of the bases of each toes. And then I can place the toes in the right position for her just through a stab incision, which requires only one suture. And once that's done, I'm able to then tape her and keep the toes in exactly the position that I want it to be. So just looking above, you can see her before x-rays and her after x-rays. And on her after x-rays, you're going to see that small cuts were made at the very end of each of those bones, just to align it better. We also do some tendon balancing procedures as well. Again, the tendon balancing also is another small incision that we made with a very small blade. Sometimes at the end of the case, I find it hard to even find where my incision is. That's how small it is. And through that incision, we're able to lengthen and reduce the contraction of the tendons. So in case you don't understand about hammertoes, hammertoe is, I call it like a tug of war that happens in our forefoot. As we get older, our muscles on the top of our foot and the muscles behind on our legs, they kind of fight each other. One of them overpowers the others. The flexors can become very strong. The flexors are the ones on the back, right, where we have our Achilles, our gastroc, and then you have the extensors are the ones on the top of our foot. Okay, those ones help us extend our toes. And as we get older, okay, we can have arthritis. We can also have muscle weakness. And those tendons, the ones on top kind of lose the battle where the flexors, the one underneath, kind of gain more advantage and makes the toes curl up. So by doing the tendon balancing technique where we use a small stab incision and release the tendon at the level of the joint before the main part of the foot, we do it both below and on top. And that helps to release the tendon and allows it to be in a neutral position. When we tape it in that neutral position, those tendons are going to find themselves over time. They heal well. And, but now they're not healed in this contracted position. And, that is more pleasing to us. We're still able to wiggle our toes. We're still able to walk and do everything, but we do not need any hardware to assist us for the toes to heal in a nice position. We tape it with some stero strips. People tape in different ways, but I like to use stero strips. That way everything stays nice and sterile and clean right after the surgery. And you'll be able to see the position where the toes are after the surgery. You're going to be able to see her picture 1 month out, her x-ray 1 month out after surgery. And you can see how the bone is already healing. Our body is just amazing. Bone healing is amazing. Within 3 to 4 weeks, believe it or not, that soft bone callus is solid enough that patient, again, can even go into a regular shoe and not have any issue whatsoever. I like to, tell my patients to stay in their surgical cam walker boot. The cam walker is like a surgical cast, okay, but it's removable. So after the surgery, okay, I allow you to walk from day 1. Okay, the patients just get out the chair and they're able to just walk and go to the car, and maybe somebody drives them home, and they're able to, do their daily chores, cook and clean and everything. And I tell them, when you get a chance, when you rest, elevate, ice that area. But as long as you stay in the cam walker, when you walk in a home, you're going to be just fine. And they do just fine. They come back to the clinic about 3 days after the surgery, and we check on them to make sure that there's no excess bleeding. And most of the time it's not, because it's just a small incision. And you can see a picture of the patient's follow-up picture. You can see the picture also of a patient where the sutures have already been removed. And I usually remove the sutures in about 2 to 3 weeks after surgery, and we just take x-rays to follow up. Finally, you see a picture of the patient with the final outcome. She has her nails painted beautifully, and you can see how natural the toes look. It doesn't even look like the patient had any surgery, but her toes that were kind of like clinging to the ground, that had like that 90 degrees angle to the ground, is no longer there. Her toes are now straight. They have a normal natural curvature, which our toes should. Naturally, we have our own normal curvatures. We all don't walk around with toes that are super, super, super straight. There's a normal natural curvature which comes out, and the body gets to heal where it wants to heal, where it should heal. Not in a very rigid area or very abnormally looking area. And the patient, did very well. And we actually went ahead for this patient about a year later, and we went ahead and did the other foot. So patients come out super happy. And the fact that it is an in-office procedure just under local anesthesia saves the patient a lot of headache, because they're more comfortable. They don't have to worry about having a general anesthesia with tubes going down their throat. They are able to communicate with me right after the surgery. In fact, we celebrate at the end of the surgery when they see their before x-rays and their after x-ray and how straight their toes are. There's so much joy in the room, and we create a very nice environment where we listen to their music, and we sometimes even have conversations during the surgery. But again, most of the patients are so happy, and they're just ready to refer and get any of their loved ones or their friends to come and have similar experience with me. So again, something to learn about minimum invasive surgery. By having no tourniquet, the patient has beautiful perfusion of the foot throughout the entire surgery, which means that the blood is always flowing. And as you know, we need blood flow to keep areas clean, to keep us free from infection, to keep the area nice and cool, and to reduce the risk of post-op complications. And the patients do extremely well. So guys, I hope you learned something today about hammertoe corrections. I am excited about bringing in more cases for you guys to review. If you have any questions, just hit me on the link above, and I look forward to the next episode. Bye-bye.